My name is Abby Fowler, and I did my interview at Primary Children's Medical Center. I interviewed Allison Jenkins. She has a master's in social work and is a licensed clinical social worker. She became employed with Primary Children's as a part time employee. She works full time with troubled adolescents at a clinic. She has had the opportunity to switch to full time at Primary Children's, but declined the offer due to the emotionally draining nature that comes with working with kids in a hospital setting. She also has had opportunities to switch to different IHC clinics that would give her the opportunity to work with a different population of people. On our tour, I saw a lot of sick kids and their families. I heard a lot of conversations between staff members brainstorming how they would handle certain situations, and I saw the social workers working together to ensure that their patient was getting the best care that they could. Primary Children's Medical Center opened on May 12, 1922, as part of LDS Hospital. In 1975, IHC became the new owner, and in 1977, Primary Children's became affiliated with the University of Utah Hospital. In 1990, Primary Children's moved to its current location in Salt Lake City, and the social work program has grown bigger and bigger throughout this whole process and is now open 24 hours a day and available at all of the IHC clinics, including Primary Children's. Primary Children's, including the social work department's mission statement, is the child first and always. This means that they ensure the best care for the children at the hospital. Primary Children's Hospital is a private nonprofit organization. The social work department receives funding through billing insurances as well as receiving donations from outside parties. In order to work as a social worker at Primary Children's Hospital, an individual must have either a bachelor's of social work or a master's of social work and be a licensed clinical social worker. In order to do clinical work, an individual must have their master's and be licensed. At Primary Children's Hospital, a social worker's salary range is based off of their level of education, their years of experience working in the field, and their years with the company. The higher level of education that an individual has, as well as the more experience they have working in a field, the higher their pay scale will be. The social work department at Primary Children's major goals are to help children and parents cope with medical fears, anxiety, depression, and other issues, to aid in grief, loss, and end of life issues, and to help communicate with the medical team. Because Primary Children's Hospital is a medical hospital, their primary professions include medical doctors, nurses, social workers, child life specialists, translators, as well as other staff. The social work department at Primary Children's serves children, adolescents, as well as their families. They work with all different socioeconomic groups, including individuals that are in foster care or are under DCFS custody. They deal with individuals from all over Utah and even surrounding states. On the micro level, the social work department at Primary Children's aid in loss and grief for children. They help children that have suffered major trauma as well as support children throughout their hospital stay. On the micro level, they deal with difficult parents, aid in grief and loss when a parent has lost a child. They help parents get through when their children have suffered major trauma, as well as support families and other staff at the hospital. The social work department at Primary Children's Hospital offers services and programs that help with grief and loss and suicide. They also make referrals for patients in order to get into Ronald McDonald housing, as well as see other therapists or social workers that they think could better handle the situation. And IHC and Primary Children's has a lot of specialty clinics. They have social workers working at these clinics 24/7, and they know how to help the individuals with the specific diagnosis and how to cope through this. Primary Children's Medical Social Work website has a lot of very useful information. I linked the website on this slide so you guys can all visit it and look it over. A potential client would learn the roles of a social worker at this hospital, as well as find billing and financial assistance information to help them get social work involved with their child. They offer hotel discounts for families that are traveling from out of state, and they have additional community support that patients have access to on their website. My experience with touring in the hospital as well as interviewing Allison was amazing. All of it was meaningful. I could not think of any negative thing about it. The most meaningful experience was getting to hear how satisfied Allison was with being a social worker. I also asked her for a lot of advice on how to be a successful social worker, and she told me to just put myself out there, and that was really something I needed to hear because I've been worried about getting into this field. I also felt that it was a great networking experience and helped me get my name out there at Primary Children's, where I one day hope to work. My role at this agency was to observe as well as ask Allison questions that I had regarding the field of social work and the agency that she works for. Um, I really learned a lot from this experience, and I think it was very insightful of what social work really is.